In this video, I'll cover how to fix colic in your newborn, including techniques for relieving gas pain, tips for preventing abdominal pressure, as well as probiotics and natural products that actually fix the problem. You'll definitely want to save this video and stick around to the end. Hi, I'm Dr. Eileen Shi, founder of Little Roots Pediatrics, a holistic practice dedicated to fostering healthy kids and babies. If you are a parent looking for sensible solutions addressing the root cause of your child's health, check out littlerootspeds.com for more articles on different topics and schedule a discovery call. We have lots of free resources for parents looking to avoid the side effects from conventional medicine. Now let's talk about colic. The traditional definition of a colicky baby is a healthy baby under 3 months of age who cries excessively for more than 3 hours a day, for more than 3 days a week, for more than 3 weeks. So we call the rule of threes. The cry of a baby with colic is intense and can sound like pain and screaming, and during the cry, the baby can be hard to soothe, leaving parents feeling helpless and anxious. There are several different theories about the root cause of some babies who have colic. Some think that newborn babies are not all ready to be born yet and have immature digestive systems that might need time to process nutrients. Some think that around 2 to 3 weeks of life, bacteria known as microbiomes start populating baby's gut. And some of this bacteria are more problematic than others. Multiple factors contribute to the ecosystem of bacteria in your baby's gut. And some experts think having an imbalance of good versus bad bacteria at this young age can cause gas pain and discomfort. So therefore, treating a baby with colic and soothing the baby will require patience on the parent's side. And we will look at some of these physical and biological hacks on treating colic. Number 1, prone position. Since it is most widely accepted that colicky babies have gas pain, we want to consider some ways to minimize gas extension and buildup. Number 1, so place your baby prone over your knees or over your shoulders. Gently rub and pat his or her back. We know by the law of physics that gas rises. So by placing your baby face down while maintaining open airway and not covering his or her mouth or nose or overextending or flexing the neck, we will allow the gas to minimize its expansion in the bowels. Number 2, nipple troubleshooting. So if you're bottle feeding, consider trying other bottles and nipples that might be more effective in eliminating gas from feeding. Some companies make milk bottles with an innate mechanism to eliminate milk bubbles, and some may be a better fit for your baby's mouth to suck efficiently without swallowing too much gas. Number 3, burping. Burping your baby is a matter of skills and art, and it gets better with practice. Try burping your baby after every feed. If he's taking more than 40 milliliters, try burping your baby by breaking up the feed to allow the gas bubbles to be released. Number 4, try smaller, more frequent meals. Feed babies smaller, more frequent meals. The bigger the volume feed, the more space the stomach must stretch to hold the milk. Sometimes, with a good letdown from breast or a bottle nipple that is too big for the infant, your baby may be taking too much milk in one setting. So this can lead to reflux or spit-ups, which can cause discomfort as it brings up stomach acid with a chest burn sensation. So for instance, if you're feeding your baby 4 ounces of milk every 4 hours, maybe try splitting that to 2 ounces every 2 to 3 hours instead, so that your baby can digest more easily. Now we're going to talk about some biological hacks, since we know that gas in the gut can be either swallowed from the feeding process or produced internally from the microbiome within. So we can consider supplements and dietary factors that can help with gas production. Number 5, breastfeeding diet or formula composition. So whether you're breastfeeding or giving formula, consider the nutrients that go into the milk that your baby is taking. Just as some foods can cause gas in the adult diet, so can they cause gas in babies. In breastfeeding moms, try determining your level of tolerance with different portions of gas-producing foods. Common ones are lentils, beans, cruciferous vegetables like any kind of broccoli sprouts or broccoli or cauliflower, dairy products, spicy foods, and aromatic foods like onions and garlic. If you're giving formula, maybe your baby is not tolerating some of the ingredients in a formula as well as those found in other brands. This may be a trial and error process, but before switching out the formula, speak to your pediatrician about what is safe and how to change the formula for your baby without stressing out your baby's gut with too many changes. One note to go over here as a holistic pediatrician is that it is also valuable in observing your baby's poop and having a good idea what is normal versus not normal bowel patterns and fecal appearances. While infant poops can range anywhere from soft, uniform yellow stool to cottage cheese to soft green and brown poop, mucus and pale clay color stool is not normal. Also not normal is currant jelly color stool and thick consistency, and that is something worth mentioning to your pediatrician, as all these may be signals for problematic digestion such as malabsorption, inflammation, and allergy. Number 6, probiotics. Try a probiotic. Probiotics are gut bacteria that make up part of your gut microbiome that offers beneficial health outcomes. Over the years, hundreds of studies have come out studying the correlations between different species of bacteria and the disease conditions. There is research with good evidence supporting a few probiotic superstars, and these are bacteria species that have shown reduction in infantile colic symptoms. So on my website, littlerootspeace.com, you will find more information on this topic. And if you made it this far into the video, you're about to learn the biggest hacks in infantile colic treatment. Superstars of probiotics for colic. Now, Lactobacillus reuteri DSM 179838. This one has been the most studied probiotic and supported by the strongest evidence in reduction of colic symptoms in babies, which means that it actually has been shown to decrease the crying time and the fussiness in exclusively breastfed babies. Lactobacillus rhamnosus GG also has been shown to be helpful. We think that is because it has synergistic effect with other probiotics strains such as Bifidobacterium breve B632 and CECT 7263. Lastly, worth mentioning a superstar is Bifidobacterium BB-12. It has been shown to help with intestinal anti-inflammatory effects in both breastfed and formula-fed babies. Okay, don't forget to like and subscribe for more content such as this. And if you or someone you know is experiencing or dealing with colic, be sure to share the video with them. Lastly, comment below and tell me about your thoughts on what was covered. Well, I'm curious to learn about your experience, and as always, this is Dr. Eileen Shi with Little Roots Holistic Pediatrics, and I will see you here next time.